Who doesn't want to know the answer to this question? What is the best painkiller for your low back pain? After all, 80% of adults have dealt with low back pain at some point in their lives, and about 25% of people have had low back pain in the past 3 months. And certainly we would all appreciate a quick fix, like a silver bullet for back pain. But the reality is low back pain is so prevalent in part because it's so complex. It can be coming from issues with tight muscles, from weak muscles, from too much joint mobility, from not enough joint mobility, poor lifting mechanics, daily posture issues, and on and on and on. So what's a person to do? We're certainly not going to accept that it's just part of life and there's nothing that could be done about it. We don't see it that way, and we don't think you should either. And though there's no silver bullet, one of the most consistently beneficial medicines for treating back pain is movement. It doesn't matter if it's acute pain or chronic pain. It's one of the most widely studied and well understood things in the scientific literature as it relates to low back pain. And despite the research, though, it sometimes can seem counterintuitive because sometimes you hurt your back as a result of a certain movement you've done. And sometimes after the initial injury, certain movements hurt. So the key here is that we figure out what movements to do. But I want to talk about why it's so essential. It can produce anti-inflammatory molecules that can help calm things down. It can release feel-good hormones from your brain that, well, help you feel good. It can prevent muscle spasms and increase tension in your muscles. It can increase blood flow and flush things out, and on and on and on. It can help you sleep, which is all going to help restore how you can feel. So movement is super, super essential. But again, the key here is what movements? And it's a great question. The answer is a little bit more ambiguous because people are so different and so unique in their circumstance. The key here is that we can diagnose properly and understand what's at the root of your issue. So if you're unable to come see us for whatever reason, or you want to go at fixing your low back pain alone, we respect that. Here's what you need to do in that situation. Try to identify patterns. Try to look for certain movements that might be well tolerated, that doesn't really increase and flare up your symptoms in a significant way. Progressively push the limits and do it safely. The more you can push it and the symptoms don't flare up, the quicker things are going to resolve and the sooner you're going to get back to kicking butt, taking names.